My approach to the neck is as follows. There is going to be what I call the first minimal phase. So getting on that escalator analogy again of aging, the first little stage where you get to the point where you see a little bit of laxity in that area. Some of that laxity can really be addressed well by doing something like Exilus. Exilus works very well at this. Basically what you're doing is you're applying energy underneath the levels of the skin in order to grow some collagen, tighten up those bands, and really hold the neck up. Your neck's like a hammock, okay? So you basically have 0.1 of attachment, 0.2 of attachment, and it's strung between the two, just like a real life hammock. So you go and lie in there every day, then what happens is eventually that hammock is just gonna start sagging a little bit, okay? Gravity pulls it down in the middle. So same thing happens right here, okay? You've got gravity pulling down, you may have a little bit of loss of soft tissue, loss of strength of those underlying layers, things tend to sag a little bit. So at the very bare initial phases, just like the hammock, what are you gonna do? You're gonna untie the hammock, pull those ropes a little tighter, and tie it, and that solves the problem. So minimally invasive, you can kind of do the same thing with Exilus or something to that effect. Apply some energy to basically tighten those ropes. Now, stage 2, you've done that a few times, you know, loosen that thing, tighten it up, and it's still saggy. Well, now you got to do something about it. And that normally requires some sort of a procedure. And there's several different types of procedures. And just like the hammock, so we need to find out whether the hammock is intact and it's saggy, or some of the threads in the middle of the hammock are frayed so that when you lie in the hammock, your butt kind of pooches out through the middle of the hammock. So exactly the same thing happens here. So if everything is intact, great, we can do a procedure and lift it up from the sides. However, if those threads are worn in the middle and fat's pooching out in the middle, we actually need to put a few stitches in here, close that all up to give that nice sharp neck feature. So it really depends on what type of anatomy that the patient has, what stage they are, that really determines what needs to be done.